Today's video is going to be about hepatitis B because it's something that I think a lot of people have misconceptions about, don't understand, and it is something that is in the news and now subject to a lot of political back and forth. So hepatitis B is a viral infection of the liver, and it's transmitted a couple of different ways: through blood and body fluids, so that could be transfusions, that could be injection drug use, that could be tattoos; body fluids, so that's sexual transmission, and also, and really important for the purposes of what's being debated now, mother to child, meaning a pregnant woman can pass the virus on to her child. So hepatitis B can cause acute hepatitis, which would be nausea, vomiting, jaundice, and sometimes liver failure. But what's really important about hepatitis B is it often causes chronic hepatitis B. So that causes chronic inflammation of the liver, which over time leads to cirrhosis and liver cancer and need for liver transplantation. So not everybody that gets hepatitis B gets chronic hepatitis B and liver cancer, but one group is particularly vulnerable: children who acquire it from their mothers. So if you get hepatitis B as an adult, it may not cause any major problems for you, but if you get it as a child, especially if you get it as a newborn, you will likely progress to chronic hepatitis B. There are antiviral treatments for hepatitis B, which are plus minus. They do work and they are effective and they are important, but they're not the main way that we deal with hepatitis B. The main way we deal with hepatitis B is through vaccination. And this vaccine is highly effective at preventing infection of hepatitis B. It's a series that you get. There are a couple different versions of it, and there's even better vaccines out there now for hepatitis B. But one of the key things is making sure that we're preventing liver cancer from hepatitis B. And to do that, you need to make sure that people, when they're children, aren't acquiring the virus from their mother. And you could say, oh, we can test mothers when they're pregnant, but sometimes you test them and they get infected after the test, or maybe they don't get tested, or maybe they don't have prenatal care, maybe you can't get the test back quick enough. So the key thing had been to vaccinate newborns before they leave the hospital so that they are protected. And that's been the program and the policy for some time, and it has driven down hepatitis B cases. So it's not as if children are doing injection drugs. That's a caricature. It's the fact that a mother might be infected unknowingly and her testing fall through the cracks, or the testing not be logistically possible. That's why hepatitis B vaccine is given to newborns before they leave the hospital, why it's recommended. And it is not harmful. So even if it's superfluous because the mother is negative for hepatitis B, it doesn't cause any harm. So this is a really important policy that needs to remain in place.